Now we've been looking at antiphospholipid syndrome, and we spoke about a lot of things. That we said it's an autoimmune condition, and it has a lot of things, antibodies and all of that. So we said that it's associated with some other disease conditions in the body, right? So we're now trying to pick out the lupus anticoagulant, okay, and the anticardiolipin antibodies. What are their clinical associations? Okay, lupus anticoagulant, the anticardiolipin antibodies, what are their associations? So you should know that for major associations, you can see the lupus anticoagulant and the anticardiolipin in medical conditions like thrombosis. All right, you can see them in thrombosis of the vein, that's venous thrombosis. You can see them in thrombosis of the artery, that's arterial thrombosis. Okay, so once you see them, they actually help you to confirm that there's a thrombotic issue. So you see them also in pregnancy morbidity. All right, so probably in somebody that has had what, repeated miscarriages, somebody that their baby has died after just 10 weeks of being pregnant. Maybe the person has severe eclampsia, okay, or placental insufficiency. Maybe there's preterm birth, okay. So all of them, you can basically see those markers there. Then you can also see them in systemic lupus erythematosus, okay, and their presence significantly increase the risk of thrombosis in patients having systemic lupus erythematosus. Then you can also see them in thrombocytopenia. All right, that's low platelets, right? You can also see them in a disease condition known as the livedo reticularis or the livedo racemosa. It's a mottled net-like skin pattern, okay, that is usually associated with antiphospholipid syndrome. Of course, those markers, you see them in antiphospholipid syndrome. Antiphospholipid syndrome is associated with whatever we have been calling, okay. You can see them in cardiac issues like the Lippmann-Sachs endocarditis. You can also see them in things like stroke, that's neurological manifestations. You can see them in stroke where there's all those thrombosis. You can see them in transient ischemic attack. You can see them in cognitive issues, all right? People having cognitive issues, probably due to blockage of the retinal arteries and all of that, okay? So these are all the medical conditions which you are likely to see markers like lupus anticoagulant and the anticardiolipin antibodies.